Hi everyone, I'm Kendall with the Obesity Action Coalition. In honor of Childhood Obesity Awareness Month, I'll be interviewing Faith Newsome. Faith is the founder and president of OCEANS, a support and advocacy group for adolescents with obesity. She is also a third-year doctoral student working in obesity research, and she's participated in patient advocacy efforts by serving as a committee member for the OAC. Hi Faith, thank you for joining us today.
Hi, thank you for having me. I'm excited to be here.
Great. So to get started, can you tell us how you became involved with the OAC?
Sure. So I guess that starts as I am a patient living with obesity, and I have lived with obesity for as long as I can remember. My mom knew that my weight was going to be something that I struggled with about the time that I was a year old. So it's something that I lived with my whole life, and I had bariatric surgery when I was a teenager in high school. And that kind of sparked my interest from a professional perspective, and I had a lot of questions, and I wanted to know why there were so many families who were struggling, and so that's what led me to being interested in research. And so then I had the opportunity to go to UNC Chapel Hill and work in research there, and then also work with the hospital I was a patient at, which was Duke, and they sent me on my first summer internship to an OAC convention, and I want to say it was in Denver, Colorado. So that was kind of my first exposure to the Obesity Action Coalition, was that conference. And it was a lot of fun because I was everybody's kid there, basically. I found buddies throughout the day who sat with me during sessions and invited me to sit with them at dinner. And I just realized what a wonderful community it was during that trip. So it was a really good first interaction with the OAC.
Oh, that's wonderful. Thanks so much for sharing that with us, and we sure are glad that you got involved with the OAC. Now, you mentioned that you grew up with obesity. Can you tell us what you wish you knew as a child growing up with obesity?
So I think that a lot has changed since I was a child living with obesity, but I wish that my parents and I both knew that there were evidence-based treatments that I could be getting involved in. So before we had the opportunity to work with physicians at Duke, my mom would bring up my weight in visits with my healthcare provider, and they would always kind of respond with a biased response of eat less, move more, which I'm sure that a lot of people are familiar with that phrase. And so we felt kind of hopeless, and we felt like we were kind of doing it on our own. So I wish we knew that that had been available, and I know the OAC has some resources for getting in touch with providers for weight management care, and from a pediatric perspective, I know that there are some resources out there to find providers who can work with you and your family. But I think that if I had access to evidence-based treatments earlier on, my journey would have looked a little bit different. So that's one thing that I wish that we had known and maybe been exposed to a little earlier.
Yeah, absolutely. And thank you for sharing what you wish your parents knew as well. So I'm glad that you did come across the resources that OAC has to offer. Now, one thing that children with obesity do experience is forms of weight-based bullying. As an adult, do you still experience that?
I do. We just don't call it bullying anymore. It's like when you grow up, they don't call it bullying. That's not the term that's used, but it's something that I've experienced even after bariatric surgery. That has been a unique experience in terms of weight bias comments, but it's something that I still struggle with. I have years of internalized bias that I am still wading through, and at 24 years old, this is the first time that I can say that I'm happy and healthy in my body, and I understand obesity as a disease, and I know how I can manage it. And there are still days I wake up and I am frustrated with myself because of those internalized messages of if I just did this differently, or if I just did that differently, then my weight wouldn't be something that I would struggle with. But I know from, talking and attending OAC sessions and also working in research in this area, that it is a really complicated disease. So to think of it from that medical perspective has been really helpful for me. And I do think, in mentioning parents as well, that they also experience a lot of bias. When a child has obesity, a lot of time their parents are the one to blame. So in other people's minds, not seeing the amount of time and effort that those parents are usually taking to take care of their child. For example, my mom always would get biased comments about me, and what those people weren't seeing was that she was staying up late at night doing research on what she could and going to specialty grocery stores and putting in a lot of effort to make sure that I was growing up happy and healthy. So I think weight biased comments can happen as a kid, and that's bullying. It can happen to your parents, and it can be something that follows you through your adulthood as well.
Yeah, absolutely. Thanks for sharing that lived experience here with us today. Now, is there any advice that you would give to a child or a young adult that is currently experiencing weight-based bullying?
It's hard because in that moment, it feels like it's the biggest deal in the world. I remember in middle school, I had a bully who would throw paper balls at me in class and call me a whale. And then because I was growing up in a time with technology, he had the opportunity to call me after school to continue those comments. And that situation ended up being so bad that I decided to switch schools for high school. And that's a really big deal as a kid, to leave a community that I had been a part of since I was in kindergarten to start brand new somewhere else, and still be at risk for, weight-based bullying. That wasn't going to change just because I switched schools, so I was taking a little bit of a risk, and luckily didn't experience it as much. But it's hard looking back as an adult now because I have such a bigger perspective of what matters, and I had so many people who loved me. But to feel rejected by your peers is absolutely valid, and that's a really hard thing to go through. But I just would say to lean on the people that love you. I always had a wonderful group of friends who loved and supported me in between those sessions of bullying. So I would say to lean on your support system, and it is a big deal to you in the moment, but in a few years you might look back and have a little bit different of a perspective on those instances.
Wow, Faith, that's incredible advice. So now you are working with your own nonprofit organization called OCEANS. Can you tell us more about that?
Yeah, so OCEANS stands for Outreach, Community Engagement, Advocacy, and Non-Discriminatory Support, and we are a support and advocacy group specifically for adolescents. So one thing that I noticed kind of in the obesity advocacy space as I was starting to get involved with it was there were kind of programs and opportunities for kids, and then there were programs and opportunities for adults, and then teenagers were kind of in this weird middle where they could get thrown in with kids or thrown in with adults. And what inspired me was I had access to evidence-based care when I was a teenager, so I knew what that looked like being at that age. So I really wanted teenagers to have a space that would be a safe place for them to talk about weight-based bullying, which we've mentioned today, talk with other people about what their weight management journeys might look like, whether it's medication or behavioral interventions or surgical interventions through bariatric surgery or no intervention at all. I just wanted them to have a safe place to come and talk to other people who were going through the same thing, because adolescence is such a unique period in your life where you're still living with your parents or your guardians, but you're about to go into the world all on your own. So we offer monthly support groups for adolescents to come and talk about some of the challenges that we've talked about today.
Yeah, definitely. Wow, what an incredible nonprofit and organization that you are running, and what a incredible message that you have for children and adolescents today. Now, in a perfect world, children, adolescents, teenagers could live a happy and healthy life free of weight bias and bullying. How would you say we're going to get there?
That's the million-dollar question, isn't it? I think my advice is always, one thing that I love to do is if I see a story or like a news story or some kind of media where people are talking about, maybe recently it's been an increase in bariatric surgery as an option for teenagers or something along those lines. Typically, if you look in the comments, they're pretty weight biased. They're pretty not positive, very negative. It's not a good space. So one thing that I like to do is I like to go in there and I like to comment my experience, and I like to talk about just being a person living with obesity and having had those experiences. And I have found in those instances, what I'm not trying to do is change anyone's mind, because there's some people out there who are just never going to understand or accept the complexities of obesity as it is. But I think those of us who do understand it, it's important for us to create those spaces and create awareness that there are people who understand. So that's what my goal is with those comments, is if a parent has a child that's struggling, they can look and see there are people who understand. There are people who see our family and see our struggles and validate those struggles. So I think in a perfect world, there would be no weight bias. But in the meantime, I think those of us who are close to OAC's mission and agree with their vision can create those spaces. And I think a lot of that has to do online, just because there's a lot of online community, especially post 2020 Zoom, COVID, social media uptake. So I think it's just, there's a responsibility on us as individuals who understand what it's like to talk about that knowledge, to create those safe spaces, and to spread the word, and to recognize that there's some people who won't understand, but we're less worried about those people, and we're more worried with supporting the people who need our empathy and understanding.
Absolutely. I love that. Thank you so much for joining us today, Faith. Thank you for being part of the OAC community. We appreciate you bringing awareness to childhood obesity this month and every month.
Thank you.